Laser eye surgery is a form of surgery which we use to reshape people's eyes if they suffer from conditions such as short-sightedness, long-sightedness, astigmatism or reading problems. The most common form and most advanced form of laser eye surgery is something called LASIK, which is spelled L-A-S-I-K. Now, what that involves is the use of two lasers. Now, this is the Wavelight FS200 laser, and it performs the first step in LASIK surgery. It creates the tiny little flap on the top surface of the eye. It's the fastest laser system in the world that we currently have, and it takes 6 seconds to do that flap on the patient's cornea. Once that's done, the patient stays on the bed and they travel over to our second laser, which is the eczema laser. Again, this is the fastest laser suite in the world. This laser actually reshapes the surface of the eye once we lift that flap up. So it's called flap and zap LASIK, and what that means is a flap is created firstly with the femtosecond laser, and then the zapping or the reshaping of the cornea occurs with this second laser, the eczema laser. The whole process takes 6 seconds with the flap and about 2 to 10 seconds with the eczema laser. Very fast procedure. Both eyes usually take about 10 minutes to be performed. Minimal discomfort, and patients in 99% of cases can see 20/20 the next day. Laser eye surgery is now the most common procedure in any form of surgery in the world. The second most common is cataract surgery, which is another type of surgery that we perform. We suspect that in a population like Australia of 23 million people, almost 10% of people have had some form of laser eye surgery. Everyone over the age of 45 ends up needing to require glasses, either in the form of reading glasses or glasses for distance. There's also a whole group of short-sighted and long-sighted young people who after the age of 18 wish to have laser eye surgeries. We do all facets of laser eye surgery, but in addition to that we also have a laser which performs cataract surgery as well. The standard cataract surgery involves the use of a blade to make a cut into the eye. With our specialised laser cataract machine, the laser actually makes the cuts and the laser actually breaks up your cataract. A cataract is when the lens of the eye becomes cloudy, and this special laser will actually break up the cataract, and it allows for safer and more efficient surgery with better results. We also perform what's called implantable contact lenses, which is a great alternative to laser eye surgery. And that's where we just inject, essentially, just like a contact lens, a very, very soft filmy material into the eye, which corrects that patient's error. It's very important for everyone considering laser eye surgery to do the proper research and have grounded research. You really need an experienced surgeon who's done at least 10,000 procedures in LASIK surgery, who has been fellowship trained, and I would strongly ask people to avoid going overseas for laser eye surgery. We certainly see a lot of complications that arise from inadequate surgery, such as the surgery I've been talking about where they just laser the top surface of the eye or use blades to perform the surgery. So I'd advise people to stay at home and stay safe. What makes WA Laser Eye Centre unique? Well, all of the surgeons who work at WA Laser Eye Centre, myself included, have all been fellowship trained in corneal and laser eye surgery. Now, what that means is that apart from doing our basic degree in medicine and also going on to study ophthalmology in Western Australia, we go overseas to a large international unit and learn how to do specialised techniques in corneal and laser surgery. Some people take up laser eye surgery because they think it's a good idea, but really you need to have done at least 1 to 2 years in a fellowship program overseas, learning the very high skills that's required for this operation. The other thing is that at WA Laser Eye Centre we pride ourselves on really trying to get the most advanced and sophisticated equipment possible, and we were the first in the Southern Hemisphere to get the fastest laser in the world, so that was a real bonus for us.